Hello everybody, my name is Jorge Lasso and I am a PhD student at Politecnico de Milano and University of Strasbourg. I'm also part of Atlas project, which intends to develop the new generation on flexible robotics for minimal invasive surgery. Today I'm going to present you my work for this ICPR 2020 related with a lumen segmentation method in ureteroscopy image based on deep residual unit architecture. But first, let's have some review of the clinical background of this procedure. Ureteroscopy is a minimal invasive surgery used to diagnose and treat diseases inside the urinary tract, such as urothelial carcinoma or kidney stones. These procedures consist in the insertion of an endoscope which has an internal camera that allows the surgeon to see inside the hollow organs, and as well it provides the spatial necessary information to navigate and make the diagnosis. Additionally, this procedure is carried out with another image modality, which is fluoroscopy, and also provides extra information to the surgeon to navigate. Even this procedure is very safe, there is still the chance that some complications could arise. The ones that were found were more common is avulsion, major and minor perforation, mucosal abrasion, and stricture. Having this in mind, the aim of this work is to develop an image segmentation system which is capable to be used during endoscopic procedures and which can highlight relevant information to the operators during these procedures. In this case, we focus in the segmentation of the lumen because this is the path that indicates which path the surgeon should follow. For this purpose, we collect an image dataset from this ureteroscopic procedure. The videos collected were obtained from the European Institute of Oncology here at Milan, and these videos consist of upper tract carcinoma removal. In total, we collected 7 videos from 4 patients, and here I'm showing some samples of the image data that we collect. One of the main issues with these kind of images is that in some cases they have a lot of noise, and in some other cases they could present image artifacts such as debris floating, blood floating, occlusions due to some other organs, or image specularities. So this turned the task of segmenting the lumen, a quite challenging task. In this case, we start analyzing different architectures for lumen segmentations. We start with a fully convolutional neural network. In this case, UNet in its original representation. But we realized that this wasn't enough, so we proposed some modification. In this case, the modification that we proposed was the use of residual blocks, which have already shown to be very good for other image tasks, and they have shown to be effective in other architectures such as ResNet. Furthermore, we changed the loss function that was used to train the network. In this case, we use the dissimilarity coefficient defined in equation 1. Here I am showing that the results obtained with the proposed model are more better. Furthermore, we also analyzed the different image modalities as input to train the network. In this case, image data in grayscale and RGB. And we found that the use of grayscale images actually lead to better results. But in general, both models trained with our proposed model outperform all of the other previous model tested. In this table, I'm showing you the other metrics that we use, in this case, the precision, the recall, and the accuracy. In this case, the model we propose was better in the dice coefficient, the precision, and the recall. In general, we can say that this method is effective because it has already been reported that the use of skip connections, which is what these residual blocks are formed by, are efficient to deal with the vanishing gradient problem. Also, the spatial information propagates without degradation, so this code explains why the results with this method are better. Well, with this work, we show that it is possible to segment the lumen, and it is possible to do it in a more efficient manner with the use of this proposed network. Future work could include the use of spatiotemporal data. So in this case, instead of taking single frames, taking video frames to train the networks and make prediction, and as well the use of advanced augmentation techniques, such as the creation of synthetic data with the use of generative adversarial networks. Well, that's all for my part. Thank you for your attention. And if you have any question, don't hesitate on asking.